Welcome to Savvy Seniors. I'm Mary Dilley and I'm your host. Today we have Dr. Alexandra Ginty on the show. I have to tell you, I have all sorts of questions here to ask her, and I just want to throw these away because I just want to talk about you. Oh my God, you're so amazing. I have to tell you, our producer, Nikki Wesley, is your biggest fan, and now I think I'm your second biggest fan. Tell us what you do.
So I'm originally a family doctor. I've done that for 30 years. But when I had breast cancer and I had to go through treatment, it really woke me up to survivorship. And I joined Cancer Care Ontario, now Ontario Health, as a regional lead to advocate for survivorship and cancer screening. And as time went on, I started assisting in breast reconstruction surgery because I carry a BRCA gene, and I'm very, you might remember Angelina Jolie, she
Yes.
carries the same gene. And so I was very much into the awareness of breast reconstruction, which a lot of these people like myself have to do. And so then I realized there was a gap in the system when it came to finishing off the breast reconstruction in terms of tattooing. And that's where narrative medicine, which is sort of the psychotherapy of the story, and procedural care, which is my emergency physician training, and psychotherapy as a family doctor, and my breast reconstruction assisting in the operating room, all came together to do tattooing, restorative areola tattooing.
So, we talked about this just before the show. My question was, when you have the breast reconstruction surgery, why can't they put your nipple back on? Sorry if you're getting squeamish, but this is a really important topic to talk about. So I asked why they couldn't just, when they take the breast off, why they couldn't just put the nipple back on.
Yeah.
And your response was?
It's a complicated answer because everyone's different and every cancer is different. But so often the cancer involves areas so close to the nipple that it can't be saved. Or if the skin was saved, it would die because it doesn't have its blood supply.
Okay.
So in breast reconstruction and plastic surgery, there is so much about the blood supply that's very important and dependent. There have been all kinds of various ideas of how to do this in the past, but a very successful idea is the areola tattooing. And sometimes what we do even is make a little nub of skin into a nipple, and then I create what looks like an areola, and you'd think sometimes there's no way you could tell it apart. Wow.
I've seen you on TV before, and I was very impressed with that. I haven't had cancer, and my mother did, and my aunt did, and my grandma did. They all died from it. One of my biggest fears, of course, is to get cancer and to die from it and leave my kids. But my other big fears, and it sounds, first world problems, it sounds terrible to say, but I love my breasts. I just, they're the most favorite part of my whole body.
Yes.
And if I were to lose them, I'm not sure I could get over that. And that's just a horrible thing to say because there's people out there fighting for their lives. Maybe it would change if it happened to me, of course. So you come along and you can give these women this back to them.
Yes.
And also what I was happy to hear is I asked you how long after you have the mastectomy, do they still call it that?
Yes.
Okay, how long after you have that can you have new breasts put on or reconstructed, built, and you said almost right away.
It's part of the same surgery, no less.
Okay.
Yes. So at Halton Healthcare, they make it a priority to bring the breast surgeon and the plastic surgeon together in the same surgery. Sometimes they're as long as 10 hours.
Okay.
because they'll use a tummy tuck flap type of thing. So it's the flap from the lower abdomen,
Okay.
and then they make two new breasts out of it by reconnecting the blood supply. So sometimes it's a very long surgery like that, and sometimes shorter because it might be tissue expanders, or maybe direct to implant. And a lot depends on the person's journey and the kind of cancer, because if it involves radiation, then direct to implant can be a risky option. Radiation's hard on the blood supply. So I think quite commonly those are a tissue expander. That's when they put in this sort of plastic bag, so to speak, and slowly fill it up.
Okay.
And that way you can make the skin the same size both sides, because sometimes you wouldn't want to put an implant in this one and then this one wasn't the same.
Right.
So there is this thing called a balancing mastopexy, so we'll balance the other side to match.
Okay.
Which makes sense, but the nipple's not always able to be saved for all the kinds of various reasons.
Yeah.
So that's where I come in.
Do they try and save the nipple, or is it just this is the better way to go?
No, it's just complicated in an answer. It's very individual. It depends so much on the cancer, the different kinds of procedures they're going to do. Some involve one called oncoplasty, which is just a kind of I'll make it simple and say it's a breast reduction, but the stuff they take out is the cancer.
Okay.
So that's easy to imagine how they put it back together, but it's clever how they go about the breast reduction. And that's the decision that's
Sounds
quite
amazing.
clever. And then there is the breast reconstruction. Well, sometimes it's delayed. And, you have to remember at Halton Healthcare, we're very lucky to have a team that will do it immediately.
Yes.
That requires the surgeons to make it a priority, the teamwork to coordinate that to happen, and the passion to make it happen at the same time for women.
Does OHIP pay for this?
It pays for all of this, including tattooing. When it's done by a physician, the tattooing that I have set up in our hospital is completely OHIP covered. Patients do not pay at all.
That's the best thing I've heard today.
And remember that if you 10 years down the road needed a revision of your breast cancer surgery, it's covered too. There is no time limit on that. So
that's fabulous.
It is about restoring you to where you should be if you didn't have cancer. They'll never be restored 100%.
Right.
But we get as people to feel as confident about their body as possible.
Oh my God, that's amazing. That just makes me so happy. We will be right back, and usually I tell you not to go away. I know this time you're not going anywhere. We'll be right back.